Welcome to another easy nursing review. In this lesson, we will cover Addison's disease. But before we begin, let's see if you can get this answer correct. A client with primary adrenal cortical insufficiency, or Addison's disease, is being admitted by the nurse. What clinical manifestations would the nurse look for when evaluating the client? 1. Moon face, buffalo hump, and hyperglycemia. 2. Hirsutism, fever, and irritability. 3. Bronze pigmentation, hypotension, and anorexia. Or 4. Tachycardia, bulging eyes, and goiter. Comment what you think the answer is in the comments below. Now let's begin by first learning what is Addison's disease. Damage to the adrenal cortex causes insufficient corticosteroid release, which is the hallmark of Addison's disease. Now, because there is an inadequate secretion of corticosteroids, think hypo. A malfunction in the hypothalamic pituitary control system could also be the cause of this decline. For this reason, it's also known as adrenal gland hypofunction. Stress can cause symptoms to develop gradually or abruptly, and life-threatening symptoms might strike out of the blue. Autoimmune destruction of the adrenal gland and tuberculosis are two common causes of Addison's disease. When a patient's production of cortisol and aldosterone is reduced due to an infection, surgery, or other stressful circumstances, the patient may develop Addisonian crisis. Addisonian crisis is a medical emergency. Now here are the signs and symptoms of the patient. The patient will present with weakness due to insufficient cortisol, weight loss due to insufficient cortisol, hypoglycemia, hyponatremia, and hyperkalemia, such as sweating, tachycardia, and tremors for hypoglycemia. Signs of hyponatremia and hyperkalemia are postural hypotension and dysrhythmias. Orthostatic hypotension due to poor fluid status from aldosterone deficiency. Bronzing of the skin due to hyperpigmentation from the autoimmune disease. Now, let's go over important labs and diagnostics. Labs will reflect the following: increased BUN due to dehydration, increased serum potassium from changes in aldosterone secretion, decreased serum cortisol being secreted from the adrenal cortex, and decreased serum glucose from decreased corticosteroids. Additionally, a positive 24-hour urine aldosterone level due to less aldosterone being secreted, and a positive ACTH stimulation test. ACTH acts on the adrenal cortex to stimulate adrenal hormone secretion. An infusion of ACTH is given, and the test is positive if the infusion fails to raise the cortisol level. Finally, abnormal adrenal glands appear on a CT scan. Okay, let's move on and learn about treatments for Addison's disease. Administer cortisone or hydrocortisone to replace cortisol. Administer fludrocortisone to regulate sodium and potassium balance. And of course, maintain fluid balance. Excellent. Now let's move on to nursing actions. The nursing actions include the following: monitor fluids and electrolytes, weigh the patient daily, and suggest a bone density test for osteoporosis due to a decrease in mineralocorticoids. And with nursing action comes patient education. Teach the patient that medication must be taken every day, to wear a medical alert bracelet, and to keep an emergency supply of medication available. Alright, well, you made it to the end of the video. Back to that question at the very beginning of the video. A client with primary adrenal cortical insufficiency, or Addison's disease, is being admitted by the nurse. What clinical manifestations would the nurse look for when evaluating the client? 1. Moon face, buffalo hump, and hyperglycemia. 2. Hirsutism, fever, and irritability. 3. Bronze pigmentation, hypotension, and anorexia. 4. Tachycardia, bulging eyes, and goiter. The correct answer is 3. Bronze pigmentation of the skin, particularly of the knuckles and other areas of skin creases, occurs in Addison's disease. Hypotension and anorexia also occur with Addison's. If you got it right, awesome. If not, that's okay. Just keep studying. Woohoo! Bonus nursing tip. Okay, so exams love to try to confuse students about the difference between two diseases. When comparing Addison's disease and Cushing's disease, use this memory trick. With Addison's disease, you need to add hormone, but with Cushing's disease, there's too much cushion hormone. Remember that Addison's disease involves inadequate secretion of corticosteroids, so you need to replace cortisol. Compared to Cushing's disease, which secretes an excess of glucocorticoids, so you need to remove pituitary tumors. Well, that ends this lesson. Click here for another nursing video.